Hey, what's up, Matt?
So we're going to just talk about the patient that's coming in today for you to treat.
Okay.
His name is Anthony. He's a 71-year-old patient. He just had a lung carb infraction just 16 days ago.
Okay.
So he's going to be coming in. We just want to talk about some of his limitations or contraindications he has and everything.
Yeah.
Well, first off, he does suffer from hypertension, and he also has AFib. So we definitely want to monitor his
Is
heart
it
rate and blood
controlled
pressure.
or?
Yeah, he does.
It's controlled. Okay.
As far as we know.
Okay.
He is also suffers from type 2 diabetes and everything. We want to do sensation tests and all of the tests we can do in the beginning.
All right.
Even after the exercise we're going to do later on, I want you to measure everything, measure the blood pressure and everything.
Okay.
He suffers from emphysema, so definitely monitor his breaths per minute, what he can do, and then we're going to try to improve that also throughout our sessions.
Okay.
And that's pretty much it for that. In terms of what we're going to do today, we're going to work with him. We just want to measure a Hemi Walker for him. We're going to measure him later on the parallel bars for you to do that. And then also just do your questions and interview about his environment, daily environment.
Sounds good. I'm excited to meet him.
Let's get to work.
All right, let's do it. Hey, good morning, Anthony.
Yeah.
Hi, I'm Greg. I'll be your physical therapist assistant today. I'll be treating you. Anthony, we can't have you smoke in the clinic only because there's other patients with issues, lung issues. So I'll take it. All right, thank you. All right. Hi, who are you? Kevin from Miss Sun. Pleasure to meet you, Kevin. You can stay here while I answer you, Anthony, or you can wait in the waiting room. It's up to you. I'll wait in the waiting room. I'll see you in a bit. All right, Anthony. Just tell me your first and last name real quick. Your last name?
Elderfield.
All right. How old are you, Anthony?
72.
72. And how much do you weigh?
About 165.
165. Your chart says 260, so we'll actually just take your weight today.
Okay.
Seems a little off, okay? And do you know why you're here today?
I've been having a few problems on the
Left side, okay. All right, that's good. Yeah, it says here you suffer from a minor stroke about 2 weeks ago, so we're actually going to check you out for that. It says here you have a couple other issues such as diabetes, emphysema, lung issues, a couple of heart issues. I don't know if you were aware. So we're actually going to just take your vitals, check you out, make sure you're all good. And then moving forward from that, we're going to help you out with your physical issues as far as walking and things like that.
Yeah.
We're going to measure you for an assistive device. It's going to help you get around and things like that. But let's just start with your vitals real quick.
Sure.
So I actually just want to listen to your heart sounds, make sure they're all clear and good to go. All right.
So do you want to
You can just relax.
ambulating on the stairs, and then like the first,
Okay, Anthony, sit up for me if you can. Okay, I'm just gonna take. I'm gonna listen to your heart, your lung sounds. Okay. Just take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. All right, Anthony. Thank you. Now we're actually just gonna take your pulse. How are you feeling, by the way? You okay?
Yeah, a little tired.
A little tired? Not a lot of sleep last night? Okay.
It's hard breathing.
I'm sorry?
It's hard breathing.
Tired of breathing?
Hard breathing.
Hard to breathe? Could have to do with the cigarettes.
Yeah,
Okay. All right, so you drink a bit too? How much do you drink a day?
just depends who comes over.
Yeah, it depends on the day.
Yeah.
All right, so on a Friday night, how much do you think you drink? A little bit? What's a little bit for you, Anthony?
I think 12 pack.
A 12 pack. Okay. And you drink that how many times a week? Once a day. 12 pack once a day. All right. And how many cigarettes do you smoke a day?
About a pack a day.
Pack a day. Okay. All right. All right, Anthony. You seem like a good candidate for physical therapy. So, yeah, we're actually just gonna take you over to the parallel bars. And we're gonna measure you for a Hemi Walker. Is that okay? Let's do it. All right, Anthony. So these are the parallel bars. We're actually going to measure you for the Hemi Walker today. I think they're going to be a good fit for you. It's a one-arm device, so you can use it with one arm. Your upper body strength is going to allow you to manipulate this. It has a wide base of support, so it's going to help you if you start, swaying around, using your balance. So I think this is a good fit. So we're just going to measure you for that now, okay? How tall are you again? 5'2". Okay, and what's your dominant side?
Right.
All right. So let's just get you a little closer to the bars here. You're gonna unlock your wheelchair. Perfect. You lock it again. All right, Anthony. Thank you. All right, Anthony. So first thing we're gonna do. Oh no. I got you. Just place your feet on the floor. Whichever leg you want first. Doesn't matter. All right, we're gonna remove your leg rest. Get them out of the way. Okay, Anthony, now what I want you to do is scoot. Keep your seatbelt on for now and just scoot towards me as close as you can. Good, perfect, perfect. Now you're going to take your seatbelt off. Right side dominant, correct? That's right, okay. All right, Anthony, so I want you to place your feet a little further back, nice and flat on the ground. Okay, and on the count of 3, you're going to push off your wheelchair. As you stand up, I'm going to help you. If you need help, you're going to grab onto the bars, okay? And you're going to try to stand up straight. All right, don't be scared. I'm here to help you, okay? Okay. Ready? 1, 2, 3. Okay, awesome. So I measured this to your height. Just want to see if it's about right. All right, I'm just feeling for it's a bone called your greater trunk. I know you don't care, but it matches up to your greater trunk. If you could just drop this arm real quick. Perfect, perfect, perfect. Open this up, see if it's an actual good fit. Okay. Grab it. How does that feel? Feels good? Very stable? All right. All right, you can just take a couple steps towards me. All right. All right, perfect, perfect. We're going to walk over to the stairs and we're going to practice some stair ambulation, okay? Get you ready for home.
Anthony, my name is Matt. I'm going to be PTA for today. I'm taking over the rest of this year session. I'm going to use Matt as well. Okay, so here you go.
Yep.
Okay. So what we're going to just explain to you is just how to get up using this, and also we're going to move on to walking and going up the stairs a little bit. But first, I just want to show you how to use your Hemi walker just to get up from the wheelchair or wherever you use it, and you can just follow along so you can explain to Anthony if you be in the future. And just help him out. Okay. So first, just when you're getting up from the wheelchair, it's normally how you get up, take off the seatbelt, scoot forward. You're going to use it on your dominant arm, so you're going to have it either right here or here. You're going to have it here, so you should make sure you can reach it with your dominant arm. You're going to lean put your foot back and use it to get up. You're going to have the wheelchair, so hold up the wheelchair from the arms. You're going to get up using your dominant arm, dominant leg. Get up, get up. You're up here, grab the walker. Now we're going to progress on showing you how to walk. I'm going to start off with the 3-point gait. So we're going to walk walker first, your involved side, and then your strong leg. You're going to walk like that. So we're going to show you how to do that. So if you just wheel it over a little bit. If you can lock that side for me. You have to walk on your dominant side, your right side. If you can scoot forward. Pick up your seatbelt for me, Anthony. Forward. So now put both your arms on the rest of the wheelchair, and then you're putting a lot of your weight on here using your strong side and your strong arm to get up. And then once you're up, I want you to grab that. Okay? Let's go on this side. All right. When you're ready. Yes. 1, 2, 3, go, 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 go. Good. All right. So now, like I showed you, we're going to practice walking. So, like I said, a 3-point gait. Okay. So walker first, your weak leg, and then your strong leg. Walker first. Continue. Good. Weak leg, strong leg. Let's keep going. Let's avoid any obstacles in our way. Good. Go. Go. Good, good, good. I like it. Keep going. Walker first. Keep going. And let's using your right leg, try to pivot a little bit so you can face the stairs. Anthony, do you remember in your house which side of the railing is on the stairs, so you can practice it? The right side? Okay. So let's use we're going to use the walker since you're going to go up and down the stairs. So you can also use the railing to get up the stairs, but you can also use the walker. I prefer when you practice with the walker how to use it. So move a little closer to the stairs. Can you fold your walker for me? Now, what we're going to do is use the walker, put the walker on the top step, and then you're going to step up with your strong legs for the stair. Okay, can you do that? And put on his involved side, so on his weak side. So that'll be on where I am. So you're gonna be here, and you're gonna be helping me up the stairs just in case. So Anthony, I want you to repeat the motion. Put the walker first, your dominant leg.
Yep.
And the weak leg.
Okay.
Same thing. Dominant. And so walker, dominant leg, weak leg. Okay, good. I want you to turn towards your dominant side, your right, your strong side. Good. And you're here. And now, so we're gonna do similar. We're gonna go walker first, but I want you to go with your weak side first. So you're gonna okay. So you can put the walker down. Give yourself a room for the step for your weak leg. And go step down. Good. Once you repeat the process, walker down, weak leg, and dominant leg. And same thing, walker, weak leg, dominant leg. And last step, weak leg, dominant leg. Open the walker for me.
Is that okay?
Okay. And then let's go back to your wheelchair, okay? And turn to your right leg.
I can just go like first one to some places.
Good.
What's the next one? The mom's house.
Closer. A little bit more.
Oh,
Turn to your
but it
right
is
side.
all.
Oh, and now you can
I will
See?
do it. Pay for it.
have that feel. Good. So just make sure you help your dad out of the room as much as possible. And we're gonna go back to our PTA Greg, and he's gonna finish up the treatment picture for you, okay? Good job, man. Thank you so much.
Rolling. All right, guys. Well, Anthony, it seems you did great today with the Hemi Walker. It seems like a great fit for you. You did amazing as far as the stairs. You did great. Kevin, Anthony tells me you guys have 20 steps at home. Is that correct? So you have 20 steps at home. So you're gonna do great. Kids, man. Kids. Next time, bring your daughter. Okay. Yeah, so it seems great. Do you like the Hemi Walker? It's okay. You feel comfortable with it?
Yeah,
Yeah,
man.
you're the way like you practice on the stairs.
Okay. Yeah, I actually saw on your chart you could be an avid hiker. Yeah, so I mean, I want to get you back to that hopefully soon. Get you back on that mountain. So that's going to be what we're going to work towards. So anytime we're doing any type of ambulation, just think about the mountains, the nature, and like let that be your motivation, right? So Kevin, when you guys do go home, you saw how we practice manipulating the stairs with this, so just help your dad out any way you can. As far as moving forward to the next session, the next session is going to be we're going to do exercises to work on your range of motion. Okay, we're going to work on your strength and things of that nature. So then it's yep. And as far as the ulcer that I noticed today, we're actually going to work on that. We're going to work on that next time. We're actually going to maybe apply some E-stim around it, try to close it up a little bit. Might compress it with some stockings. All right, so we'll work on that next time. Okay. Pleasure meeting you guys.
Thank you so much for your help.
Yeah, no problem. All right, bring your daughter next time. Not your son, because he wasn't paying attention. All right, and yeah, you guys have my card. If you have any questions, just call me. All right, guys, take care. No.
Hello class, my name is Matt.
Greg.
Anthony.
Kevin. We're just going to talk about our patient for today. Our patient is Anthony. He's our 71-year-old, 5'2", 269 retiree. He's just coming in today, or coming into our clinic, or our clinic right now for 16 days status post lung car infraction. Now he's also suffers from a couple other comorbidities with hypertension, type 2 diabetes, suffers from AFib as well, total knee replacement.
And anything else there, Jay, I'm missing?
Just some personal details about his life. He used to be an avid hiker and fisher, outdoorsman. He doesn't do it anymore due to his condition. He lives in a 2-story family home with no elevator, stairs. He lives with his son and his wife. His wife is disabled, and so that's what we're dealing with now. Yeah, so our goals are to get him back to hiking and doing his ADLs with no issues.
That's good. And Anthony, can you tell us about currently how he's doing in the his facility?
Currently in a short-term rehab setting. He has decreased tone. He's visually impaired due to diabetes. But he independently moves. Their mobility is fine.
Okay. And Kev, can you just talk about his other limitations in terms of functionally and actively his other body parts, his strength and balance?
Yeah, so our patient Anthony, my father, he's having trouble walking. His strength is not too good, even though he has fair strength plus in his upper body. Like Greg mentioned before, he wants to get back to hiking. Currently, right now, he doesn't have really good cardiac output, so he's breathing a lot, having a hard time expending air out. So we're gonna work on that through therapy. How can we get back to his goals?
So our patient is a retired 71-year-old, so he's on a limited income. We don't know, he's retired, so we don't know how much money he has. He only has Medicare Part A and B, so we have to be mindful that what we can get him and what kind of treatments are available to him with his insurance. We will, like we are in the video, we are getting him a Hemi walker, so we're going to have him use that as much as he can. And if he does progress, you can always use it as a unilateral aid, which is as a cane, use that to get around. He's on his second floor, he's on the second floor, so he does have some stairs, which is usable with the Hemi walker. Anybody else want to talk about maybe his wife or his son as well for education purposes? Or what any educational things you can teach him?
As far as his son goes, he was involved in the actual treatment session of Anthony. He saw him ambulate the stairs. He saw him get fitted for the walker. We educated his son as well as Anthony on how to use the Hemi walker, on Anthony's breathing techniques, things of that nature. The rest he needs to take in between his daily activities. So his son plays a big part in the recovery process of this. So yeah, hopefully he continues on the journey with Anthony.
But I also think it shows like dependence you need on, family members to help you with some of this stuff.
Definitely, so that's at that age. Patient with type 2 diabetes, check their skin at all times.
Yes.
Every day they get up, especially with the ulcers. So we already have some form of deterioration on his epidermis, so we have to be careful, especially on the heel, any pressure ulcers or diabetic ulcers. We want to make sure educate them, give them with compression stockings if available. We can give them and see if it's mesoestin, like we said before, treatment, and all that. And definitely hypertension, you can also watch their blood pressure, their vital signs, each time they come in. During exercise, we can also do that in future sessions if ever they go to. And work on their other limitations, like as we usually think we have 15% in hip flexion, loss of hip flexion. So we also want to work on that to try to see if we can recover any of that and any other disabilities or anything they have from the infraction.